Okay. Uh, First, today, thank you very much for being with us today. We'd like to start the press conference on a briefing about novel coronavirus, Japan's response. Um, my name is Tomi Yoshida, Press Secretary of the Ministry of Foreign Affairs of Japan. I'm going to be your MC for the press conference today. First of all, I would like to briefly give you the general guidelines of the press conference. Today's conference is on the record. Um, the names and the title of the briefers can be referred in articles. And the second, I would like to introduce the today's speakers and briefers. In the center, Mr. Watanabe Shoji, he's the Director General of the Office for Novel Coronavirus Disease Control, Cabinet Secretariat. On the right-hand side, on myself, Mr. Umeda Hiroshi. He is the Director of Infectious Disease Information Surveillance Office, Health Service Bureau, Ministry of Health, Labor, and Welfare. And the third speaker, Mr. MATANO Seiji, he is sitting on the right-hand side of the podium. He is our Attorney, Deputy Director of Immigration Department, Immigration Services Agency. And there, Mr. KITAURA Yasuhiro. He is the second from the right on the podium. And Mr. Kitaura, Director, Foreign National Affairs Division, Consular Affairs Bureau of the Ministry of Foreign Affairs. Today's topic subject is the recent coronavirus situation, the assessment, as well as their decisions undertaken by Novel Coronavirus Task Force on August 28th, last week. The briefing will be made first by Cabinet Secretariat and later followed by the Consular Affairs Bureau of the Ministry of Foreign Affairs. And today, in addition to the journalist gathering here, there may be the people who have a prior registration and participating in the conference through the YouTube live streaming. And we would like to take their question, both for the people here and the individuals watching on online basis. The participants through the online, please send their questions by email to the address of the International Press Division of the Ministry of Foreign Affairs. Then we'd like to start their briefing. So please start, Mr. Watanabe. You have the podium.
Yoshida.
Thank you very much, Mr. Yoshida, for the kind introduction. I am Watanabe of the Cabinet Secretariat. First of all, I would like to thank the foreign press for taking time to attend today. And this afternoon, we would like to explain the recent situation around the Japanese government's handling of the novel coronavirus. Based upon the information gathered to date, by taking the strategy of avoiding the 3 C's and encouraging the implementation of new lifestyle practices and implementing effective measures commensurate to risk, by controlling to the extent possible patients in critical condition and death, that it is possible to pursue both the prevention of infection expansion and activation of socio-economic activities. And based upon such position, without redeclaring status of emergency, we are making efforts in order to pursue both. Please refer to material number 1 in your handout. As indicated, after the coronavirus emergency declaration was lifted, the number of infections steadily increased through July. The task force on the novel coronavirus that gathered on August 7th made a proposal to the government, which is on material number 2, the next page, titled The Basic Strategy to Balance Social and Economic Activities with Measures for Infectious Disease. These proposals were made as a result of the task force gatherings since July 16th. The coronavirus infection status as of July 16 was at the gradual increase line shown in orange on the chart below on this page. Considering the worst case scenario, and in order to avoid reaching the red explosive expansion line, our goals are to do the following within the limit of balancing medical, public health, and economic activities. 1. Contain infections to stay within a manageable level and minimize the number of deaths and the number of patients in critical condition. And 2. Take prompt actions and get the new infections trend decreasing as soon as possible. As such, as indicated in the green box to the right, the government has begun implementing the measures outlined in the chart below and the green box to the right. As a key point of crisis management, we established worst-case scenarios and began preparing for them in advance. If you could move on to material number 3, to this end, we defined the infection situation from stage 1 to stage 4 and requested that each prefecture observe the situation very closely based upon these criteria. As I said, as of July 16th, the situation was in gradual increase. There were some areas that were in stage 3, and our goal is to improve the situation from the current status, and also to be prepared without hesitation for the implementation of further measures in the case of worsening. So such guidance and direction was given to each prefecture. Please refer to page 4, the material 4. As noted in this slide, the standard indicators for various categories, such as availability of hospital beds depicting the load on medical system, PCR test positive ratio, which show the monitoring system, and number of new reported cases showing overall status of infection were shared so that the central government could closely coordinate with prefectural governments, make comprehensive decisions, and engage in proactive measures to better the situation. As you can see on the next slide, material 5, given the proposal for measures to be enacted for stage 3 provided by the task force, we are now implementing flexible reduction of contact opportunities as a whole. The portions highlighted in red are the key focus areas for stage 3. Again, these indicators and measures were clarified in order to identify the worst-case scenario and establish a shared understanding by the central and prefectural governments so that the measures can be taken without hesitation in case that the signs of worsening are spotted, as explained previously. As part of the Japanese system, the prefectural governments have the authority to enact public health measures in most cases, and it is the duty of the central government to provide appropriate support. Therefore, having a shared understanding becomes critically important when engaging in effective measures. Such activities have shown effect, and we were informed at the August 24th task force meeting that certain regions have seen gradual decrease in the number of newly infected persons as of late July. Please refer to the next slide, Material 6. This is a report from the task force which compares the characteristics of patients from the first wave from the outbreak to the end of May and the second wave, which began on June 1st. As the task force used the terms first wave and second wave, we will follow such nomenclature for the sake of convenience, meaning first half and second half. First item is the number of infected individuals. The total number of infected individuals is much greater in the second wave. However, the second item, the ratio of individuals 70 years or older, has decreased from 20.3% in the first wave down to 8.8% in the second wave. A characteristic of the second wave is the greater number of younger patients. From the middle, the number of deaths was 900 for the first wave, but the number fell to 219 for the second wave, and the final item, the number of individuals younger than 50 years old, has been very low during the entire pandemic. Therefore, more youths have been infected after June, while there have been relatively few deaths for patients younger than 50. Testing capabilities have been expanded, and the time from onset to notification has been reduced, and medicines such as remdesivir and dexamethasone have become widespread, thus significantly reducing the overall number of deaths. This trend can be seen in the graph on the next page, material number 7. The graph on the left shows the cumulative number of infected individuals. The black line shows all infected persons, while the green line reflects those younger than 50. The red line outlines those who are 70 and older. As you can see, the green line representing those younger than 50 is raising the overall number. The graph on the right shows the cumulative number of deaths. The black line shows the total number of deaths, and the red line outlines those who are 70 and older. The red line has been shifting upward from August, something we must be on the alert for. On the other hand, the green line for those younger than 50 has only increased slightly since May. Therefore, we are in a situation where we must decrease the number of new infections, focusing on younger citizens while also providing solid medical assistance for seniors and patients with severe symptoms.
これらの足元の状況に関する
So, and with the assessment of the government and various specialists on the current status, the government had announced on October 18 and 28th the new activities. And please refer to Material 8, in which I would like to give you an explanation on it. As you can see here in this Material 8, we have newly decided on 7 planned measures to engage in, with further consideration to the upcoming influenza season. As a prerequisite for these measures, we have identified the following trend from the data. That is, 80% of those infected have not become spreaders of the virus. Further, 80% of the infected persons recover with mild or no symptoms, while 20% have faced worsening of pneumonic symptoms. So, that the persons are 65 or older and those with pre-existing conditions are at a higher risk of worsening symptoms. The first measure is the revision of the authority around hospitalization recommendations per the infectious disease law. Currently, under this infectious disease law, the novel coronavirus is classified as a designated infectious disease, whereby recommendation and/or processing for hospitalization is required. As such, recommendation for hospitalization is made for patients with mild or no symptoms, raising the possibility that hospital space for patients with the severe symptoms who truly require focused treatment may become difficult to procure. We have been looking to revise the infection disease law to allow alternatives for patients with mild to no symptoms, such as not requiring hospitalization, and ensuring recuperation at hotels or at individual homes. Second is a sweeping expansion of testing schemes. We are looking at greatly expanding the number of antigen testing kits in order to implement approximately 200,000 tests per day. The third is securing medical care provision. This involves the provision of further support ensuring the stable management of medical institutions. Multiple medical institutions accepting novel coronavirus patients are experiencing financial difficulty, and we aim to support them continuously. The fourth relates to remedies and vaccines of the novel coronavirus. The government will secure the future supply of any remedies and support appropriate research and development to ensure that the vaccine will be provided to the entire nation during the first half of 2021. The fifth is the maintenance of the public health center scheme. In order to ensure the continuation of public health centers that have acted as counseling services, counters for citizens and vigorously helped track disasters, the government will assist in the development of a dispatch scheme of public health nurses across municipalities. The sixth is the maintenance of epidemic crisis and crisis management systems. Through the coordination of the National Institute of Infectious Diseases and National Center for Global Health and Medicine, we will establish a system to promptly evaluate, gather, and disseminate information on the severity of infectious diseases and epidemics. The seventh and the last is the expansion of testing relating to international travels. This involves securing testing capacity for 10,000 persons per day for entries into Japan at Narita, Haneda, and Kansai airports. The government is set to achieve this during the month of September. This encompasses the planned measures and that the Japanese government has announced on August 28th. By implementing these measures, we would like to lay the path to appropriately balance further prevention of the pandemic and socio-economic activities. Thank you very much.
Thank you very much, Mr. Watanabe. Now, I would like to invite Mr. Kitaura to brief you about the cross-border travel restrictions.
はい、外務省
I am Kitaura, Director for National Affairs Division, Consular Affairs Bureau of the Ministry of Foreign Affairs. On the 28th of August, decision was made by the novel coronavirus response headquarters, and of the decisions made, I would like to explain to you with regards to the resumption of cross-border travel and other measures. A4-sized handout should have been distributed to you, and please refer to this material. The first point is with regards to re-entry into Japan by foreign nationals with status of residence who are residing in Japan. For those who have status of residence, taking into account the expansion of testing capacity at airports and other factors, after they go through certain processes, implemented from September 1st, foreign nationals residing in Japan with the status of residence will be permitted to re-enter Japan from the country or region designated as an area subject to denial of permission to entry into Japan. Second is re-entry of foreign nationals with the status of residents who have already departed from Japan. Foreign nationals with status of residents who had already departed from Japan when the country and region is currently staying became an area subject to denial of permission to enter into Japan on August 31st will be permitted to re-enter Japan from today, September 1st, by going through specific procedures. 3. Measures to prevent the spread of infections and others. For those who re-enter Japan in the cases that I mentioned above, the additional quarantine measures, such as the presentation of a certificate of being tested negative by a test conducted within 72 hours prior to the departure time of the flight, will be taken for the prevention of spread of infections. Number 2, the testing capacity and system at airports will continue to be strengthened. Number 4, continuation of the current border control measures and other steps. First of all, additional designation of areas subject to the denial of permission to entry into Japan. Designating the entire areas of 13 countries that are listed as areas subject to the denial of permission to entry into Japan based on the Immigration Control and Refugee Recognition Act, and entry into Japan by foreign nationals who have visited those designated areas within the last 14 days will not be permitted unless there are special exceptional circumstances. And those who enter into those areas within the last 14 days will be subject to test. And this measure will continue from 0 hours of 30th of August for some time. 3, continuation of the current border control measures. Until August the 8th, additional quarantine measures have been decided, including visa restrictions, limitation on the number of arrival airports for passenger aircraft, and measures to curb the number of arrival passengers by flight to Japan to be implemented until the last day of August, which was decided at the 41st meeting of Novel Corona Response Headquarters, will be renewed and will continue for the time being.
I'd like to take their questions. First, I would like to take the questions from the individuals who are gathering in this briefing room. Please raise your hand and first identify yourself and the agencies that you belong to. Then I will appoint the questioner. Mr. Kitaura will have to leave around 4:40, so I'd like to prefer taking questions about their travel resumption measures first. But later, maybe somebody else can take the podium. But anyway, if you like to have a question to Mr. Kitaura, that would be the priority. Then after the people who are watching the online will be the questions will be taken later. So please go ahead for questions.
Nishimura of Radio France, and I have two questions. First, on patients with severe conditions. Some prefectures have different definition of patients in severe conditions. What's the reason why there is no uniform definition on nationwide basis? Secondly, I have a question on re-entry by foreign nationals. Amongst those who have status of residence in Japan, do you have any updated data on the number of such people?
My
name is Umeda of the Ministry of Health, Labor and Welfare Health Service Bureau. Let me take the first question, which is on the difference of definition of patients in severe condition. We've been reported the number of people who are receiving treatment in ICU and also who are on respiratory devices. So that is the categorization based upon which MHLW receives reports. But for example, with regards to the Tokyo metropolitan area, not just patients who are in the ICU, but there are some who are in ICU but are not on respiratory ventilators. So they may not be categorized as severe condition, and those patients are being monitored based upon the indicators set forth by the Tokyo Metropolitan Government. So there could be such slight differences. But in terms of nationwide comparison, in order to conduct effective nationwide comparison, uniform definition may be necessary. So we have requested the Tokyo Metropolitan Government to apply the same criteria, but TMG has been continuing its monitoring based upon their own definition. So they have to take into consideration their operations, but we have been asking them to report on the nationwide definition basis, and we are also making the same request to other prefectures. On the second question, I will respond. My name is MATANO Immigration Services Agency. As of 13th of August, the approximate number under the Immigration Control Act, the status number 2, permanent residents, spouse or child of Japanese nationals, spouse or child of permanent residents, and long-term residents. Of those who are either one of those 4 status and are outside Japan, 101,000, and Appendix 1 of the Act. And this includes business people and students. About 91,000 were outside of Japan as of that date. So those are the broad numbers for Appendices 2 and 1.
Thank you. Rocky Swift with Reuters. My question is about the World Health Organization COVAX facility. August 31st was the deadline for countries to express their interest in participating in this worldwide facility for providing vaccines. And as of late last week, my understanding is that Japan had not yet made a decision on that. Can you give an update on that and any other vaccine-related updates? Thank you.
Mr. Kato, Minister for Health, Labor and Welfare, he has announced that Japan has expressed its confirmation of intent to participate to the COVAX facility. But also, this is a kind of a non-binding confirmation for the participation, and official deadline for the official participation will be September 18th. Over. Thank you.
Any other question from the briefing room? Yeah, please, go ahead.
Sorry, Rocky Swift again. I might as well get in my second question here. This is a kind of general question for the Health Ministry. In previous briefings, we'd heard that the R naught figure, the effective reproduction figure for the coronavirus had gone below 1. So in fact, it was reported to be 0.5, 0.6 or so in late May, June or so. So in theory, this meant that the virus should have disappeared within a week or two. So I guess my question is, that's kind of a mystery. So was the surveillance wrong at the time in terms of the reproductive figure, or is there something else about this virus that we've discovered about the way it spreads? Thank you.
はい、ありがとうございます。自己再生
Thank you very much. On the self-reproduction figure, at the task force or the advisory board, discussions have been taking place, and the analysis had been done. And in this context, if it surpasses 1, that means the infection expands. And if the number becomes below 1, then that could be a sign of subsiding. And at the moment, peak out from the recent status had been seen, and that had led the number to become below 1. And of course, we have to continue to watch closely how the trend develops, but it might be going towards subsiding. But will it disappear? I think we will just have to continue to watch and monitor the situation. We cannot say anything for sure. The way novel coronavirus spreads, one of the characteristics of the way it spreads is that it spreads unknowingly without people noticing. And even if the number drops to below 1, there is no assurance that it will disappear. So we will constantly have to monitor the situation.
Okay.
Okay.
Then I would like to turn on the questions made through the online YouTube. We have here the similar questions from the 2 different agencies, coincidentally. And so let me read the questions. Can you give us more detail on how many vaccine supplies you have secured and from where? And if you still aim to secure more? And another question similar is, can you share why you're confident that you will have a vaccine for the entire nation by the first half of 2021? And the question followed by the question about the Olympics. Does this effort make you optimistic about holding the Olympics next summer? Does that include the chance of hosting the Olympics in 2021?
はい、
With regard to the vaccine, first of all, now the current status of development of a vaccine, which I would like to briefly talk about. I think it was briefly reported on the press. As far as we are concerned, there are two companies. We came into a basic agreement in order to secure the supply of vaccines. We have established the supply route. Now, internally and internationally, there will be, regardless of where vaccines are going to be produced, we would like to supply vaccines to the people without any delay. And that in that way, we have been supporting efforts for the development of vaccines. And through this process, Pfizer or AstraZeneca, we came into an agreement with those two companies. As for other things, internally as well, domestically, there are some companies working on the development. Sioni Nogi, UNA Pharma, Daiichi Sankyo, Angus, KM Bio, and ID Pharma. Those are the names of the companies that are working on the development of vaccines. And internationally speaking, there are different companies that are working on the development as well. Therefore, as has been mentioned, those two named companies, and they will produce internationally. Takeda and Novavax have entered into the partnership and to produce vaccines domestically. And we have this plan as well. Therefore, those vaccines, as far as those are concerned, we are now still in consultation with them. And so that depending on the status of development, we would like to materialize the supply of vaccines and to the people without any delay. Therefore, when it is supposed to be supplied, we would like to do it as soon as possible. And from that viewpoint, we are in consultation with those developers. There was another related question. In the first half of 2021, and we ask, with regard to that target date, it is difficult to tell you when that is going to be materialized exactly. But as I mentioned earlier, as soon as possible, in light of the current negotiation. And we also have to put in place the delivery system. Therefore, we are working on that as part of our preparatory work as well.
来年のオリンピック
Now, there is another question about Tokyo Olympics and Paralympics next year. IOC and the organizing committee, they are working on that for preparation. IOC meeting on July 15th, Mr. Bach mentioned that the IOC is continue to be committed to the hosting of the Olympic next year. Now, the roadmap that is prepared by the organizing committee, there are going to be some measures to be considered this week. So therefore, going forward, our ministry is going to be in contact with the metropolitan government, as you mentioned, as I referred to, in the newly established policy. We would like to put in place a scheme so that the Olympics will be held securely. Needless to say, all the athletes are going to be invited to the Olympics, and they have to be given full opportunity and to play in the safe environment. Therefore, for that to be achieved, we would like to work together with the Tokyo Metropolitan Government as well as IOC and organizing committee.
Again, my name is Nishimura of Radio France. I have an additional question on the Olympics. Idealistically, I think, do you think that when do you think that you should make the decision on whether it will be conducted or not? In other words, how many months do you think is necessary for preparations?
はい、すみません、ちょっと私ども
I am an officer in charge of response against novel coronavirus. And with regards to next summer, it's very difficult to foresee what measures against novel coronavirus would become necessary. But the government is in close contact with the organizing committee and the other relevant organizations so that preparations will be well underway. So at this moment, we cannot indicate any deadline. All we can say is that we are making fullest efforts for preparations. The original plan was, or the expectation was 10 million visitors coming to Japan for the Olympics. If that number actually comes, that will go beyond the testing capacity at airports. And if there are those who test positive, they would have to be sent to various facilities. How long will it take for such preparation? Or will you make the decision early on that we cannot, or you can accept 10 million people? And is there a possibility that you will decide some capacity and then begin preparations for the Olympic Games? At this juncture, I cannot specify any number or any specific timing. It's extremely difficult to go into such specifics, but at any rate, we are comprehensively considering those matters. That's why the relevant parties are getting together, and this week we will have a meeting to discuss those matters.
じゃあ次のやつつって大丈夫ですかね。北浦さんいなくなったけど大丈夫。はい。Before moving to the next question, apologies for failing to mention the names and agency who made their the previous questions from YouTube online. So let me quote the two individuals. One is Mr. Simon Denier from the Washington Post, and the another journalist was Ms. Motoko Richie, New York Times. Then I'd like to introduce you the next question. Mr. Thomas Stolder from the Swiss Public National Broadcaster. So let me quote. He's asking about their the border cross travel measures. For example, a foreign man is married to a Japanese wife. They have 2 kids and living in Japan for 15 years. Now the family is traveling to the home country of the father and coming back to Japan. The PCR test before departure, flying back to Japan is negative for the family. Then there is a second test after arriving, right? If the PCR tests after arrival in Japan of the father, the wife, and the 1 kid are positive, then under the new rules from today, Japan will send the father back to his home country because he has a foreign passport, even though he has a permanent residency. But the Japanese wife and the 2 kids, if they have the Japanese passport, the Japanese wife and the kids can stay in Japan, or can the father also stay in Japan?
I think this is about the quarantine measure procedure related question. So allow me to respond to your question. This is MATANO, Immigration Services Agency. With regard to that kind of model case, the husband is a foreign national, and the Japanese wife and Japanese nationality children. In that case, the father's re-entry condition that requires a PCR test, and the result is negative. And then at the airport, at the quarantine, as part of the quarantine procedure, both Japanese nationals and foreign nationals have to go through the testing once again. And once this test is going to turn out to be positive, then the quarantine measure is to be applied. This is something I understand from the information of the Ministry of Health. Now, as for the service to be provided by the Immigration Service Agency, this kind of the quarantine or the isolation is not going to be is not within the category of the service of the Immigration Service Agency. But in my understanding, the father is not going to be deported. Rather, he is going to be quarantined or isolated in order to be provided with recuperation as well as a treatment. And afterwards, after the certain period passes, and after the medical treatment is applied and administered, and then once again, the immigration procedure is going to be applied once again. Therefore, at that point, if the conditions are met, that the father will be able to enter the country. So it is not going to be the case that only father is going to be sent back into his home country.
そうですね。結果的に、お父さん
So that means if the father is going to be tested the negative at that time, then he is also allowed to enter the country.
Thank you. We have one more follow-up question from Mr. Simon Diner, Washington Post. It's a follow-up question about vaccine. Do you need to test foreign vaccine within Japan before administering them here? What sort of delay might this entail?
On foreign-made vaccines, what are the necessary procedures? That was the subject of the question. Of course, clinical trials are done overseas, and if the safety and efficacy is confirmed, then it will be made available. And on top of that, within Japan, test will begin in addition to those trials overseas. So how long will that take, and what would be the expense? It depends on the relationship with the manufacturer that developed the vaccine, and the cost will be borne by the company that developed the vaccine. But the time that it will take will depend on the results of the clinical trial. So although those procedures have been defined, we want to make available the vaccines as soon as possible. So our policy is the smoothest introduction of vaccines, and that policy remains unchanged.
As it seems, no more questions from online participants, and so let me once again ask: is there any additional question from the floor? はい、西村さん。
西村ですけれども、一点だけ
This is Nishimura speaking. Just one clarification. Those who are able to re-enter for 2 weeks, no public transportation, there should be additional conditions to be added. And in reality, those who are admitted re-entry, is there any way to check whether they are observing those conditions or not?
はい、
Thank you for the question. After the entry, what should be the follow-up action? That's your question. The immigration office, the quarantine office. When it comes to the quarantine office, there's going to be the status of the health conditions check needs to be reported, and the public health center will make the follow-up activities. And in that way, the observance of the conditions will be monitored. In case running on a public transportation train, is that going to be accepted as accepted? Well, it is not a scheme to 100% monitor the person's behavior, but the conditions and the rules are provided to that person. So the whole program is assumed that they will observe those conditions.
So I understand that the questions exhausted, and so let us conclude today's press briefing. Once again, thank you very much for being with us today.